Okay, you guys can get out your PowerPoint for chapter 21. We're going to talk about compounding. I'm not a pro at this. This is not a nursing skill by any means. And so if you have questions, please feel free to ask. I will do my best to answer. I'll research whatever I need to do. But this is not generally something that, as far as just nursing goes, that I have a lot of experience in. So we'll look at compounding. And compounding is just like the mixing, prepping, assembling, packaging up, labeling a product, depending on the order that the doctor's given. So it's actually having to mix something at the pharmacy, not necessarily a pill that comes that's already been, made up and you're just filling it. It's just actually mixing something in the pharmacy for use. Oral liquids, topicals, suppositories, intravenous admixtures, so like adding a medication to an IV, parenteral nutrition solutions, which is like nutrition in an IV, lots of mixing, it's very intense. IV fluids is parenteral nutrition is, and so I can't imagine mixing that because it's so very specific, and so there's so many ingredients. Radioactive isotopes, cassettes, syringes, or anything like a home administration device. Usually, like I'm working in home health, I've had people before who have had IVs at home, and in doing that, they come pre-mixed. It's already ready. All they pretty much have to do is flush their IV or flush their PICC line or whatever they have, and then plug it in, and it's ready to go. Equipment, of course, you guys should be familiar with the equipment. Balances, forceps, spatulas, slabs, mortar and pestle, graduates, pipettes. Balances, specifically Class A prescription balance is required for every pharmacy. You use it to weigh small amounts. And I would encourage you guys to look up balances before you take the test on Friday, just because prescription or pharmacy balances, because you may see, and I haven't taken the test yet, so I can't really remember, but it seems like there was something else that was in there, but look that up. They might be manual or they could be electronic. Then counterbalances are for larger quantities or things that come in bulk. Here's an example of a prescription balance. Of course, weights would be used to balance those out. Spatulas and slabs. Okay, spatulas, both available, it says, are in steel, plastic, or rubber, and depending on the material, it may depend on what kind that you use. So both are used to transfer solid ingredients to weighing pans and then mix combinations on slabs. And a slab, it says, is just a glass, kind of like a cutting board almost, made of ground glass. Also might be called ointment slabs, but they have to be non-absorbent because you don't want to be mixing, and the same reason you want to clean it every single time, because you don't want to mix some, this medication that you're mixing with the next one that you mix. What if somebody's allergic to it? What if they have some kind of adverse reaction? Have to be very careful. Here's a picture of spatulas. Here's an example of a slab and how you would mix. See how they're mixing this powder in with this ointment to make it a medicated ointment. Mortar and pestle. Mortar is the cup-shaped vessel, and then a pestle is kind of that rounded tool that you use to mash it or crush, into a powder. You can get glass, wood, porcelain. Glass is usually liquids and semi-soft, and then it's non-porous. It doesn't stain. There you go. Heat guns used to shrink bands onto vials. So if you have a vial that needs to be closed, you can use heat and it shrinks it, or to dry out tablets like it says. Hot plates like you would use in the chemistry lab, used to heat substances depending on what you're mixing. Sealers to seal packages. Crimpers and decappers to crimp a vial, kind of like those vials we looked at the other day to crimp that metal. Tablet mold. Okay, so these come in different sizes, but sometimes you actually have to mold your own tablet. So if you're creating a medicine for a specific purpose, you press this medicine into the mold, and then you'll use force, and it shapes it. Now, specifically, suppositories suppositories also have mold. Same idea there. To prep them, press them into the shape that they need to be in. Graduates, of course, are used to measure liquids. And you guys know, so cylindrical graduates are designed with a narrow diameter. It's the same. That's so that you can mix it and, be very accurate. Pipettes. You guys know this is all normal chemistry equipment, but they, to measure small amounts of liquids. Okay, compounding of liquids. Liquids are the most frequently compounded form of meds. They're easier to measure, obviously, than solid forms, easier to mix. And the upper surface of a liquid in a container is called the meniscus, and you guys have probably seen that. I know you've been told this. It's kind of a moon shape. Whenever you look at it, straight on, when you're looking at something, a liquid, to measure it, and it's usually kind of curved. And look, the level of the liquid should be right at the bottom of the meniscus. Know that. You should never measure something, and I know you guys have all heard this in lab, but you should never measure something by bringing it up to your level. Instead, lay it on a flat surface, and you get down at the level of the substance there, okay? So make sure that you do that. And then the meniscus is just that rounded portion that you'll see. Compounding suspensions. Okay, we've talked about suspensions, I think, a little bit already. A suspension is a liquid dosage form that contains drug particles that float in the liquid. Now, these particles are triturated or reduced to a fine powder, and then you'll use those together. So these are usually the ones that you have to shake up before you give, because if you'll notice, after a while, all those particles kind of go to sink to the bottom because of gravity, so they have to be shaken. Solutions don't usually require shaking before you use them. You have to know the solubility characteristics, so you want to know what's going to happen. You don't want to rush it, of course. And then again with the meniscus, so make sure. Elixirs dissolve alcohol-soluble ingredients in ethanol, and then, of course, water-soluble in water. And then you add water solvents into the alcohol solvents to combine them. And then you need to watch your alcohol concentration. Emulsions, oil and water, or water and oil. It says prepared by dry gum or wet gum methods. And I have not seen that on the test, but anyways. Compounding semi-solid drugs. So semi-solids, says these semi-solid dosage forms are usually applied to the skin and mucous membranes for local or systemic effects. So these could be some of your topical meds. Mixing can be done in a mortar or on a slab. The final product should be smooth and free of anything abrasive. So it shouldn't still have any, chunks of powder and stuff in it. Ointments are oil-based. Creams are water-based. Ointments are usually harder to get off, and that's why. Paste contain higher amount of solid, so it says they won't melt at body temperature. They usually a paste will stay on, like you can see it. Kind of like, it makes you think of that cream that you put on, Poison Ivy, that's pink. I can't think of it right now. Anyway, that's what I think of as like a paste, and it stays on. Gels consist of smaller, large particles in suspensions. Okay, suppositories. Solid bodies of various weights and shapes, so they're usually inserted rectally, vaginally, or urethral, and then they're created by pouring mixed ingredients into a mold. They're usually much softer than a normal tablet, okay, because they're going to dissolve a little easier than that. Common suppository bases: cocoa butter, polyethylene glycol, or glycerinated gelatin. They're going to melt pretty quickly. Okay, solid drugs, tablets, capsules, powders. These are made by compression or trituration, diluted with sugars or moistening agents. Capsules, solid forms that enclose drugs either within a hard or soft container, usually made from gelatin. You guys know sometimes you can even take them apart and see the powder inside. Capsules are different range. It says they're filled using the punch method, so the empty capsule body is pressed into the powder until it's full. Made so that it will take the exact amount that it needs. Tablets can be different shapes, moistening the powder mixture with alcohol and water, and then they're pressed into a mold. Powders used when drug stability or solubility is an issue. So either maybe whenever it's mixed, it doesn't stay stable for very long, or isn't soluble in a lot of things. A lot of IV medications come in powders, and then they're dissolved. They like vials sometimes will have a powder in them, and then you add the solution to it. Parenteral products. So we're talking parenteral, remember, is like IV products, things that are going into the body, IM, so forth. Pharmacy techs are integral parts of this process, both in hospice and home care, lots of different areas. Even in regular pharmacy, you're going to give out sometimes medications that, are meant to be drawn up. Parenteral products must be prepared in a clean room using aseptic technique. It has to stay sterile, because you don't want something entering into your body that's not sterile. You're going to get an infection. Okay, so that's that for chapter 21.